Welcome to JF Nursing class. Today in this video lecture, we will discuss about normal range of systolic blood pressure and normal range of diastolic blood pressure and what is pulse pressure. So the normal range of systolic blood pressure is about 90 to 140 mm of Hg. The normal range of diastolic blood pressure is 60 to 90 mm of Hg. And what is pulse pressure? Pulse pressure is the difference between systolic blood pressure and diastolic blood pressure is known as pulse pressure. So what is pulse pressure? The difference between systolic and diastolic blood pressure is known as pulse pressure. So how we can calculate the pulse pressure? Normally we have to subtract the diastolic blood pressure from the systolic blood pressure. How much it will come, that is will be known as pulse pressure. So normal range of pulse pressure is normally 30 to 40 mm of Hg. Normal range of pulse pressure is normally 30 to 40 mm of Hg. So here are some key points you have to remember. Which of the following pairs linking an artery with its supplied area is incorrect? So here all are is correct only this one. Superior mesenteric artery is supplying the stomach. Normally superior mesenteric artery is not supplying the stomach. Yes, superior, as you can see in this picture, superior mesenteric artery is supplying the small intestine, cecum, appendix, ascending colon, first 2/3 of transverse colon supplied by superior mesenteric arteries. So here are some clinical scenario also there. A 50 years old patient visit to the clinic for the routine checkup. Their blood pressure reading is recorded 130 by 80 mm of Hg. Based on the provided blood pressure reading, what is the calculated pulse pressure for the patient? How it is interpreted? So normally pulse pressure is difference between the systolic and diastolic blood pressure. Here the difference between systolic and diastolic blood pressure is around 50. So normally the pulse pressure is here 50 mm of Hg, which is above the normal range. But the pulse pressure is calculated by subtracting the diastolic blood pressure from the systolic blood pressure. In this case, the systolic blood pressure is 130 mm of Hg and diastolic blood pressure is 80 mm of Hg. Pulse pressure is around how much? 40 mm of Hg. How much it will be? 45 or 50 mm of Hg. The normal range of pulse pressure is 30 to 40 mm of Hg. Since the calculated pulse pressure is 50 mg, pulse above the normal range. So they are like this way you have to calculate the pulse pressure.